you, Jackie and Paula. What I will do now, I will open the floor to questions, but what I would say to you is that there's still a number of presentations to go. So it might be wise to take perhaps a few important questions now, because they may change when we listen to the other presentations. And then there will be time at the end to take, again, more questions. So first of all, I'm going to take Joe Walsh, Tony, and David, please. Thank you.
Thank you, Chair. Jack, I don't know whether you read Radio Merseyside this morning, but there's a GP on this morning. You just said that you had to have problems recruiting GPs, but this GP clearly said he had problems filling the post. Is that correct? Or?
Good evening, and thank you for your question. I was the other person on Radio Merseyside this morning opposite the GP who was making the comments about GP retention. Nationally there is an issue with GP retention, but as Jackie said, we to date thankfully haven't had the significant problems that they have nationally. However, it is an issue and it is something that we are working on and looking at on an ongoing basis, and we've set up some clinical working groups to address the issue of the delivery of care. The extended hours appointments, which Jackie described very eloquently, the 720 to date, have been filled, and they've been filled by local GPs. We haven't had to go outside of Wirral, we haven't had to go anywhere else, we haven't had to import doctors from other EU nations to support this. These are local GPs who are willing to provide those services at night, from 6:30 till 8 and at the weekend. And that often happens because GPs work varying different sessions within their own practices or their locums, and they're happy to do those hours, and they fit in with their work-life balance. So the 720 appointments that we are currently delivering are all filled, and we've had very good assurances from the two federations going forward that those appointments will be able to be filled from April onwards, the additional slots.
Thank you. Tony?
I've got grave concerns regarding people accessing transport to our park from all areas of the Wirral. If you're just going to have one place, one urgent care, one minor injury place in our park, you know, your figures are saying, you know, 30 a day and stuff like that. Well, we've got bus services that are breaking down, you know, every week or every other week. Avon just went bankrupt, the privatised bus service that can't be relied on. We've got austerity measures right across Wirral that are affecting council services, and this is causing a breakdown in the fabric of society and causing people very, very low car ownership right across the Wirral, one of the lowest in the whole of the country. We can't rely on our bus service for the reasons that I've just given before. Mersey Travel are really going to struggle to subsidise any bus services because of the pressure on their levy, because of the knock-on effect of austerity regarding our council services. It's going to be really, really expensive for people to go up to our park, you know, even if it's a bus service. But I'm assuming that people who have got a minor injury or are very poorly will probably need to get a taxi, and taxis can be very expensive going from different parts of the world. So I think this is a real barrier to people accessing them services at our park. Our park was built without a proper transport strategy attached to it. It's basically in the middle of the countryside, where the countryside starts on the Wirral. There's no train station going up there, there's no train station anywhere near it. So it's really, really reliant on what is a very unreliable bus service, given that it's a privatised model I can break down in a minute. Just one additional. 10,000 people have signed a petition as well. 10,000 people have signed a petition, and them 10,000 people have got them same concerns.
Well, that's very welcome. This is not a public, although it's an open meeting, it's not a public meeting.
What are any consultation?
We're going to move on to the next question. Jackie, if you want to answer Councillor Norbury's concerns, please.
Thank you, Chair. Really pertinent questions, and they have been a concern. We acknowledge that for many people. I think it's really important to let people in this room know that we've had the first very constructive meeting, and we've agreed. We've had the first quite constructive meeting with councillors, Mersey Travel and council commissioners for transport last week. Some of the councillors, part of that group, are in the room tonight. We have been working with Mersey Travel, and I can tell you that with the collapse of Avon, there was an opportunity that presented itself, and there has been, certainly for the South Wirral patch, which is probably the poorest locality served at the moment, there's been additional direct bus routes hourly provided in Wirral. That information is available if people wish to see that. We're happy to make that available. That's in the public domain. And they go live last week. So there's already significant improvements. The purpose of that group, very quickly, is to absolutely understand the different issues around attending our park. And they are very different depending upon the locality, and to look at what those solutions are. The CCG is clearly not statutorily responsible for commissioning transport, hence we're working closely with councillors who are, the councillor is a commissioner, and with Mersey Travel. And the final point I'd make is, on the activity that we've shared, the local offer, the people going locally will still continue to go locally. This is about actually taking out that variation of having a local consistent offer. There will inevitably still be people who need to have access to further detailed diagnostics and more specialist intervention, and that's the group we're targeting to go to our park. So we're not looking at lots of people having to move up there that currently get a local offer. That will still remain, just in a different form.
Dr. Brame, do you have something to add to that?
Yeah.
No, Tony, can I just say...
Well, it's incorrect.
Tony, I'm going to listen to what I'm taking it that Dr. Owen has something to add. We're then moving to Councillor Burgess-Joyce, who was next, and then I've got Christina.
Well, sorry, mine was on that very point.
Well, if we could just, if you could just bear with Christina, if you could just bear with us,
We've already
please.
put somebody else in ahead of us. And it's on Larry's point, and we don't want to point
Is this related?
Sorry, I was making the point that somebody else has already gone up in front of the councillors, and I was asking the question on the very point that Councillor Norbury had raised. And rather than have it lost while we go round other questions, I felt if with respect to Dr. Callum, if she's being allowed in, I feel really the council should be as well.
Yes. Councillor McManus, I'm more than happy for Councillor Muspratt to answer or to ask her query.
Thank you.
And then I'll come in if that's okay.
Councillor Muspratt.
Yes, as one of the councillors who was on that original group, I didn't attend the meeting last week, mainly because I can't see the point in having a meeting in November and a meeting then I think in March or some other time. The bus company in my area, when Avon affected everybody, not just people going to hospital, but the staff, because it ran between the two hospitals. Something needed to be done and not at a meeting on the 8th of November, which is why we as councillors and people on Mersey Travel, and I include my colleagues from Clatterbridge and Eastham here, had to do something very quickly. So whilst I appreciate we might have done something, there was a lot done by us. And it's a half-hour service, and it finishes at the last bus really is 6:30, effectively. And there's no service on a Sunday. So it'll be fine if nothing happens to any of us in the evenings or on a Sunday.
I just wanted to pick up on a point that Jackie made in relation to your concern around transport. And another issue that's been raised with us is parking, and parking at the Arrow Park site. And I go there a lot for meetings, and I understand the difficulty of driving around trying to find and hoping that the parking angels will shine upon me so that I can get a space. The offer that we have on the table and that we're consulting on and proposing on is around maintaining that local offer. And so I'm not for one moment proposing that all the patients who are seen in minor injuries and walk-in centres currently will then have to go to the Arrow Park site. That's not what this is about. This is about improving the delivery of care within each community across the 4 different localities and ensuring that those patients who only really need to go there to the Arrow Park site are sent to the Arrow Park site. And when we look at the data from last year, a figure of 6% of patients who went to the Hour Park site, only 6% of those patients needed to be seen there, which is why we want to strengthen the offer and the delivery of care and the delivery of urgent care within the community. And so, if I can in any way dispel your concerns and worries about transport and parking, that transport and parking will only be for those patients who absolutely really need to be at the Hour Park site, and the delivery of care, health and care, will continue within the community.
Thank you for that. I'm going to bring in Councillor Burgess-Joyce. If you can just come up to the mic, David, and then I've got Councillor Gilchrist, and then we move on to our next presentation.
Thank you, Madam Chair. Thanks for allowing what appears to be the full relation of children's services in to ask a question. The question, good evening, Dr. Callum and Mrs. Evans. It's probably not entirely far away from what's already been mentioned, but I'm just conscious, if I can just bring you to the page 15, I think it's page 11 of your document, page 15, and it specifically states around urgent care services for 0 to 19-year-olds. And it says that locations for these services will be decided at a later date. Now, I'm sure I've obviously been remiss, and I've probably missed amongst your long presentation where those are going to be cited. But I think it does go back to what other councillors have said. If you're a mother with children that are unwell, one might suggest, given what you said about educating the public, which I have a slight issue with that terminology, but if they've got children who are unwell, it's not just about where the bus route is, it's actually physically how far away it is. I mean, you have a bus route, but if it's entirely 20 miles away, then that mother is going to be pretty concerned about that type of distance. So I think I have one question, but it's probably got some long tail, so you might want a pen. It is very much around where are they going to be based? Are they going to be decided upon after the 12th of December, when no one has an opportunity to make any comments about it from the public? And if you're looking to re-educate the public, how do you intend to make what you've got as a very complicated set of diagnostics and methodology? How are you going to simplify that so that people don't have to start looking where they can go when they need an emergency? Thank you.
Thank you very much for those questions. Okay, so to answer the first